So, hi guys, my name is Dr. Kevin Dapaah and I'm a dentist. I'm one of the founders and I'm the clinical director of the Dove Dental and Wellbeing Spa. We are based in Earlsfield, Southwest London, and we're an independent clinic that likes to take care of people's teeth. So we do general dentistry, cosmetic dentistry. We also do implant dentistry, and we also do facial aesthetics. So they're common like the Botox, fillers, and skin tightening. So we kind of do that. So we are an all-rounder kind of dental and aesthetic clinic, if you like. So as a dentist, so in my day-to-day practice, one of the common reasons why people come to see me is pain. Okay, one thing I say that no matter who you are, everyone has got teeth. So at some point, we become relevant to nearly everybody's life, because at one stage or another in people's life, they may have an issue or something they want to correct, something they want to improve when it comes to their teeth. So one of the common reasons why people come to see us is pain, because no matter who you are, we respond to pain. And whenever someone's in pain, they want to get better or be relieved of that pain, and I do love doing that for people. So I usually say that the dentist is not a place that everyone likes to come to see us. So people usually come if they have an issue or pain, or people usually come if they have a desire, want to improve, correct, or enhance something. Okay, so one of the reasons is pain, and that's one great thing I love about my job, because people come in one way, and in a matter of, it could be 30 minutes, people come out feeling so much better, and that brings joy to me as a clinician, as a person, as well as caring for people and for people to be better. And if you was to get someone out of pain, people don't forget you. So that's one of the reasons why people come. And one of the other reasons why people come is because of the rise of social media, and I think the culture and where we're moving and the direction we're moving towards, people are becoming more image conscious. So that is relative to how people look, how people dress, and part of that is how people smile. So because people have become image conscious, they want to almost improve, upgrade, or enhance what they already have. So people come and say, so some people come and say, they get a celebrity and say, Kevin, I want to look like this. or they come and say, Kev, I've got this, or where it could be down to so many things. So someone has crowded teeth, or teeth that are spaced out and want to straighten them, that's where we can help. If people want to whiten their teeth, or make what they have brighter, that's where we can also help. And if people want to have a total transformation, that's also where we help. So one of the common services or treatments that I provide is something called Invisalign, which is a way of straightening your teeth, but it becoming not so obvious. So people nowadays, even though we do offer it, most people don't want the train track experience like what they had when they were younger. So people are looking for a more discreet alternative and still achieve the same results, and that's what we commonly do. Another thing is people ring and call us all the time is something called composite bonding. So one thing is important is that what's kind of happened recently is that a lot of people who have also recorded their experience online go to other countries to have their teeth done. They call it dental tourism, and why people go there is because they perceive that it's cheaper to go there. But what's happened on the flip side of that is that people have seen that when you go to have certain treatments, their teeth are shaved down quite a lot. So people have become really scared of it. And I'll say that the main cohort of my patients are between the ages of, say, 23, 24 to about 38. So it's a very young cohort of patients I see. And because of that, and even as a British trained dentist, we have been taught to be minimally invasive. And minimally invasive basically means that we try to do as least irreversible dentistry to your teeth as much as possible. We try to do that throughout your life, but especially because you're younger. And it doesn't appear that other countries' cultures or how they're trained have that same view. So when people go there, they see what's happened, they come to me and say, Kev, I don't want that kind of thing. So as a result, people do come to see me for things like veneers. Well, veneers, the way I kind of describe veneers is basically, it's like, when these ladies go for their kind of nail, what do you call it, these nail things, yeah, where they stick the critical. It's a similar kind of principle, right? So we minimally adjust what you already have, and we put something on top to kind of give you that nice, proportionate, even and white and bright smile. We still do that all the time, but we do more minimally invasively. But people do call us a lot for something called composite bonding. So composite bonding basically is that it's a white filling material which we stick or bond to your natural teeth, and it still gives a really good natural positive result with minimal alterations. In some cases not much at all, but in a lot of cases you can have only minimal alteration to your natural teeth. So the whole idea is that you preserve the majority of your natural teeth, and that's very important, obviously to the patient and to us, because if I do anything, I'm going to be seeing you again and again and again. So it's important that we do what we can first time. So a lot of the reasons why, in my experience, that I see people is because of A, pain, and B, because they want to enhance, upgrade, or improve what they already have. So I do get a lot of young people ask me, for example, if they're under 18, they're whitening their teeth, I say no. Or people who have social pressure, because we're on one side, I love doing the small makeovers, the improvements, stuff like that, because you see the value it adds to people for their confidence, what it does for their career, their lives. So whether it be a musician, actor, professional person, or someone, especially people who are in front of the camera, I do love seeing the results. On the other side, there are people who have the pressures to look a certain way. And I'll be honest with you, I think one major part of my consultation is trying to suss out, try to understand the patient. So try to understand what is it they want, and try to understand why they want what they want. And I tell people at the beginning of my consultations that I want you to leave here being empowered with the options that are available to you, and I want you to know, because I don't want people to say, oh, Kevin didn't tell me this, Kevin didn't tell me that. I want people to have the full scale options. And sometimes what people come in for, by the time I've spoken to them and consulted them on what they're looking for, some of the times we come out with a different result or a different plan. And what I'm trying to say is that your smile is unique to you. You're unique to your personality, your being, or whoever you are. It's unique to you, and it's not to be as somebody else. It's cool to say, Kev, you want similar to this, which is great, but it was also unique to you. And that's why when people do go abroad, you find that a lot of people go for the exact same treatment, where my thing, I will comfortably tell the patient, I'm sorry, I don't think this is a good treatment plan for you for X, Y, and Z. If it means I don't treat the patient, or that's fine by me, because I want to be able to sleep at night knowing that I've given good care and treatment delivery to the patient. So what I would advise anybody who feels under any pressure or anything like that, I would say, talk to a dentist that's conscientious, that really cares about you and can give you an honest opinion, professional opinion on what you actually need. And if it means, and sometimes it could mean not yet, it may not mean necessarily no. But it's our job to try and let you understand what you're trying to go for, the ramifications, the implications, and the alternatives. So it's very important that you speak to a professional for them to try and tailor a plan that is suited to you and not because of everybody else.
Thank you so much.